This is Duncan Turner from the Vagina Doctor podcast. Welcome to the Consult With Me segment where we take a deeper look into our most frequently asked questions. But what do I know? I'm just a vagina doctor.
So we had a great podcast with Michael Brookins from Age Management Institute. So much information that a lot of people had to listen to it twice. And some of the questions that have been coming through are about the weight loss peptides. And we get a lot of calls every week about that. So I thought, let's do our consult with me about the weight loss peptides.
Thanks. You hear a lot about peptides these days, and I think it's appropriate to start with to explain what a peptide is. Basically, the chains of amino acids, which are part of a protein molecule. And most of the time, these are the same group of amino acids that are involved in human growth hormone. They're precursors to human growth hormone. Peptides themselves have variable effects. And one of those has been found recently to suppress appetite. And it was actually a medication that was developed for control of type 2 diabetes and was seen to have a significant weight loss associated with the patients that were on this medication. And so that the FDA then approved the medication for use of in the weight loss circumstance, and the specific one was semaglutide.
Now, when people say Ozempic, and then we say we have semaglutide, go into that.
Well, Ozempic is a trade name.
Mm-hmm.
Semaglutide is the pharmacological name. But there are a number of very similar peptides that work in the same way. And they can be given by injection, as with Ozempic, or as we do in the office with semaglutide, or we used to when we could get the semaglutide in California, which has been difficult recently. But they can also be, it can be taken orally as a pill or as what we call a troche, which is something that dissolves under the tongue. Other peptides that are used for appetite suppression are AOD, and that's actually been around longer than the semaglutide for weight management. And the way that works is there are basically two functions. One is that this medication, the peptide, will slow gastric emptying, so a patient will feel full for longer after eating, and therefore less hungry afterwards, and also to suppress the appetite through the central nervous system. Very effective. Patients really don't have to struggle with the urges of appetite and don't seem to have other side effects. Now, what we've seen in patients is occasionally patients will have nausea or vomiting after use of the medication, but that's almost always if they have controlling their diet while they're on the semaglutide and they go off that diet and suddenly eat a lot more than they had been for the last few weeks, and they will basically overfill their stomach and have nausea and vomiting. None of this appears to be dangerous, and there are more and more of these peptides being approved by the FDA for the purpose of weight management.
So the two we're using a lot in the office, they're the troche, which dissolves under your tongue.
Correct.
And we're using the semaglutide and the AOD,
yes. Or
sometimes both.
Yes.
For patients that are maybe having a more difficult time losing weight, right?
Yeah.
Do they do different things? Because I heard like the AOD boosts your metabolism. Like I've heard like the AOD, like a lot of young girls are using to have a slimmer waistline because
yes.
It burns fat.
Right.
It actually burns fat. Is that right?
Well, I think it's a little more complicated than that. it's not just about appetite suppressant. It is in changing the metabolism.
Right.
Yeah.
It boosts
So
the AOD.
I just don't like the
Yeah.
word burning fat. I think it's a little.
I mean, but to differentiate, the AOD, it seems, is very trending right now with young people like Hailey Bieber and like that whole group of young models.
Right.
That they're all using AOD.
And it's probably because you can get AOD more easily than you can get semaglutide.
Okay.
So that might be the reason.
Along with other peptides. They're in
Right.
the whole longevity, like Michael Brookins was talking about. They're doing all of that, and they're in their
Yes.
20s.
Yes.
So, and then the semaglutide is more of a weight loss,
Absolutely.
appetite suppressant.
Right.
Okay.
And it's very effective. And as I was saying earlier, it's just, it's easy for patients because normally in a weight management program, you're restricting calories and sometimes not using medication at all, which is really tough for patients because their bodies are used to eating frequently, used to having 3 meals a day. We use this in conjunction with intermittent fasting, and which is just controlling the time of eating during the day to a certain number of hours. The semaglutide takes away that that yearning for food to a large extent. So people feel it's almost painless, so easy to lose weight on this. Yes, they're reducing calories, but it's not been a struggle to reduce the calories they're taking because they're not hungry. And the medications that have been used for this in the past have been amphetamine derivatives.
Right.
That's the one that's been there for years and years and years, and it's a controlled drug.
And some people still need that to lose.
Yeah,
Right.
they do, but
It seems.
yeah,
We have a couple patients.
right.
Oh, shoot. I lost my train of thought.
We'll take a quick break here for our advertisers.
No, I was going to ask a question about something we were talking about. Oh, I know. So years and years ago, as you know, I was put on naltrexone.
Low dose naltrexone.
Yes. And it was for another reason within my immune system. But I noticed in the first couple weeks, I lost 5 pounds on naltrexone. And I was taking 3.5 milligrams. And I didn't, what I noticed is I didn't crave sugar any longer. And I didn't crave alcohol. Not that I ever drank a lot of alcohol, but, and I certainly wasn't trying to lose weight. There was no calorie restriction happening. It was actually a really, a time in my life where I was cooking a lot and eating a lot. So I think that's really interesting. And I know we also work that into our diet program as well, right?
Yeah, low dose naltrexone is actually used with one of the medications FDA has approved for weight management. And it hasn't had much use in any other part of medicine other than reducing cravings for people that were addicted to opiates as well. It was very helpful in those circumstances. In the autoimmune disease picture, it seems to be helpful as well. And that was the reason that you were taking it. The other aspects of it is that there was this weight loss part of it, which was really rather subtle, but it was picked up by some investigators and put together with this weight management plan, and was FDA approved for it within the last probably 5 years.
Yeah.
But it's again very safe drug, but we don't really know how it's working. And
but it does.
But it does.
And for people with cravings, it really, like, even when you're taking a sip of wine, you're thinking to yourself, I don't even feel like drinking this wine.
Right.
Yeah. And I really remember the feeling of being on that.
Yeah.
So
good.
Anyway, I'm glad we have it in the plan.
Yes, we do.
Okay. Anything else that we can help our listeners figure out with these weight loss Peptides. I know they're really safe. And when I talk to the pharmacist about it, they say, oh, people work them into their lifestyle and maybe they'll take them for, a few weeks or a month, and then they just have them to use every few days just to stay on track. Is that?
Yeah, we, in our weight management program at Turner Medical Arts, we're very close with our patients. We see them every week. All the people that are on a weight management program are seen every week. They get full blood work at least every 3 months. And they have that evaluation first with blood work to be sure that it's safe for them to do this. Any of these things need to be, they appear to be safe, but we've got to really keep a close eye. So we see them every week, we weigh them, we talk to them, we see what they're doing,
what they're eating.
Course, what they're eating. I mean, we have all of them have an app that they enter all the food that they have every minute of the day. And so we can look at a lot of different parameters just to see what's going on, because it is still low calorie. It's still controlled medication. And I don't mean that in the legal sense of controlled medication. It's just something that we are very precise about giving to patients. Really good program. But the other thing that just leads me to briefly mention is continuous glucose monitoring. And that's been very, very informative for patients in terms of, you've seen these things advertised on the television, the sensor that's applied to the skin and continually measures blood sugar for somebody. Really, really helpful for diabetics, both type 1, type 2. But for people in a weight management program, you can see how your body responds to certain things. And then you can choose to avoid those things. And I know personally, when I've used this, I've been very aware of what I'm eating. And if I've got the sensor on, I'll be much more cautious.
You're obsessed. Let's just say it. You're obsessed with that app.
This is a purely medical experiment on myself.
Yeah, exactly. We all know. We all see the spike when it happens.
Yeah. I show it to everybody.
Yeah. Well, we'll have to do another consult with me on that, because there's lots of funny stories about the Freestyle Libre blood glucose monitor. So
yeah,
let's
and
save that.
And actually, and your experience.
And my experience with it. So
okay.
All right.
Thanks.
Thank you. Thanks for listening. And if you have more questions, please let us know either by email or DM us on the Vagina Doctor podcast.
See you in the next episode. The Vagina Doctor podcast. It all starts here.